Hey everyone, and welcome. If you're on the path to becoming a nurse, you're basically training for battle. But the thing is, your biggest opponents are completely invisible. So today, let's get you armed with the intel you need to win.
You've probably heard this quote from Sun Tzu before, but it's never been more true than in a hospital. In your world, the enemy is a universe of invisible microbes. And trust me, understanding them isn't just about passing an exam. It's your #1 strategy for keeping your patients safe.
And a special shout out to everyone in Dr. Ramey's microbiology course over at College of the Canyons. This one's especially for you. I want you to think of this material not as just another class you have to get through, but as the foundational toolkit you'll be reaching for every single day on the job.
All right, so let's get right to it. Why does any of this matter? I mean, why are you going to spend so many hours studying organisms you can't even see? Well, because in a clinical setting, the stakes are incredibly high, and microbiology is right at the center of everything.
You are going to be using this knowledge constantly. When you insert a catheter, you're not just performing a procedure, you are actively preventing a hospital-acquired infection. When a lab report comes back showing Staphylococcus aureus, you'll know exactly what that means and what the risks are. You'll know why antibiotics won't touch a viral infection, and maybe most importantly, you'll be the one calmly explaining to a patient why they absolutely have to finish their prescription. This isn't abstract science, it's what you'll be doing every day.
Okay, so if knowing the enemy is half the battle, it's time for a proper introduction. Let's meet the main players you'll be up against, because telling them apart is absolutely fundamental to making the right call for your patient.
First up, we have viruses. Think of these guys as the ultimate hijackers. They aren't even really complete cells. They're just little packets of genetic info that have to invade our own cells to make copies of themselves. That's what obligate intracellular parasites means. And since they use our machinery, antibiotics are totally useless against them. That's why our best weapons are things like vaccines and really strict infection control.
Next on the list, bacteria. These are single-celled workhorses that can multiply at an incredible speed, but they have a weakness. See that phrase, peptidoglycan cell walls? That's their armor. And it's the exact target that many of our best antibiotics, like penicillin, were designed to destroy. We know how to break through their defenses.
Then there are the fungi. You'll see these as either single-celled yeasts or as molds. The key thing for you to remember as a nurse is that fungi are often opportunistic. They don't usually cause trouble in healthy people, but they're just waiting for an opening. And an immunocompromised patient, someone you will definitely be caring for, is the perfect target.
And finally, let's talk about protozoa. These microbes are often spread by vectors, like mosquitoes carrying malaria. So for you, this is where you put on your detective hat. Getting a patient's travel history is non-negotiable. A fever in someone who just got back from a tropical vacation is a whole different ballgame than a fever in someone who's never left town.
Now, to really appreciate the tools we have today, we have to look back at how we got them. And this isn't just some boring history lesson. This is the origin story for everything from hand washing to sterile operating rooms, the absolute cornerstones of your profession.
For literally centuries, everyone believed in the miasma theory. The idea was that diseases were caused by bad air, poisonous vapors from rotting stuff. And you know what? It kind of makes sense. If it smells awful, you probably shouldn't be breathing it in. But then came a completely revolutionary idea, germ theory. The wild proposal that tiny living things, germs, were the real killers.
So how do you prove something you can't even see is to blame? Well, this brings us to an amazing story about a doctor named John Snow. In the middle of a horrifying cholera outbreak in London, he decided to challenge the entire medical establishment using nothing but data, a map, and some serious critical thinking.
So while all the other experts were blaming the foul smells in the Soho neighborhood, Dr. Snow did something nobody else thought to do. He started mapping the deaths. He went door to door, marking each victim's home on a map. And almost immediately, a shocking pattern started to emerge. The deaths weren't random at all. They were all clustered together.
The data was just undeniable. Of the first 83 people who died in that outbreak, a staggering 73, let that sink in, 73 of them lived in households that got their water from one specific public pump on Broad Street. This wasn't a coincidence. This was the source.
But the real smoking gun, the piece of evidence that sealed the deal, was a local workhouse. It was packed with hundreds of people, but only a few of them got sick. And why was that? Because they had their own private water well. They weren't drinking the contaminated water from the Broad Street pump. That was all the proof he needed.
They took the handle off that pump, and the outbreak ground to a halt. Snow's detective work helped kickstart what we now call the golden age of microbiology. It set off a chain reaction. You had Semmelweis pushing for hand washing, then Pasteur proving germ theory for good, Koch figuring out how to link a specific germ to a specific disease, and eventually Fleming discovering penicillin. These are the giants whose work built the foundation of modern infection control.
Okay, let's bring it back to the present day. How do all these amazing historical discoveries actually show up in the tools you're going to be using on the floor?
Well, one of the most powerful and common tools is the Gram stain. It's a super fast, 4-step staining method that lets a lab quickly sort bacteria into one of two major groups. Think of it as the first piece of battlefield intelligence you get back from the lab.
And here is why this is so critical for you. Gram-positive bacteria stain purple because of that thick, exposed cell wall, the very thing that drugs like penicillin can attack. But Gram-negative bacteria stain pink. They have a thin cell wall, but it's protected by an outer membrane that contains something called an endotoxin. If those pink bacteria die and release that toxin, it can send a patient into septic shock. So that color, purple versus pink, tells you not only what antibiotic might work, but also what dangers you need to watch out for.
And finally, let's talk about precision. Using the correct scientific name like Staphylococcus aureus isn't about being picky or academic. It is a matter of patient safety, plain and simple. Confusing a relatively harmless skin bacterium with a dangerous pathogen like MRSA could be a fatal error. Getting the name right ensures you're giving the right treatment.
So we've come a long way. We've gone from blaming bad air to using targeted antibiotics. But the battle is far from over. As we now face the terrifying rise of antibiotic resistance, the big question is now for your generation of nurses. What will the next golden age of microbiology look like, and what role will you play in it?